Hello, Rose.
Hi, Dr. Lay.
Welcome to Fountain of Youth again.
Nice to see you. Nice to be back.
Yes, welcome back. It's been a few months.
It has.
Yes, and you look wonderful. You look well rested and refreshed.
I am.
Can you share with me how the hormone therapy, specifically bioidentical hormone therapy that I have started you on this journey, has changed how you felt? How have you been doing?
I've been doing well. But let me go back 7 years ago when I first met you and got on this journey with the bioidentical hormones. I'd gotten on them, did very well, and then took a break because I moved and there was quite a distance and I couldn't make appointments and stuff. So it's been probably 6 or 7 years. But in the meantime, I'd started to decline again and not feel very well. And so 6 months ago, I had no zeal for life, no zest, and very tired, worn out, wasn't sleeping well at night. And I noticed the strength in my body and was like really on the decline. So that's when I decided to call Dr. Lay and get back in there because I know the quality and what kind of life you can have when you're on hormones. So that's when I got back in and we took a blood test and saw where my hormones had depleted and everything, and got on a regimen. And here I am 6 months later, feeling full of life and vitality and ready to go and getting my refill done again and continuing on with the identical hormones. And I choose to do those because of the synthetics and the ones I could go to the doctor and probably get a prescription for nothing, being my age and everything and on Medicare, but I choose not to. I choose to go the natural way and something that's fitted and tailored to my needs and my body.
You mentioned that you came back to see Dr. Lay after a few years of taking a break because you had to move away. And during the years that you got off the bioidentical hormone treatments, how did you function? How did you feel?
It was okay for a while, but then the more you age and things that happen in your life, you know, stress and all kinds of things, and COVID had happened in the meantime, and that was a tremendous stress on people's life. You just feel the decline and knew I had to get back.
What were the symptoms of improvement that you noticed the fastest within 1 to 2 weeks of getting back on the bioidentical hormone regimen?
Being able to move again without being so stiff. My mood had changed also, and I had a tremendous sugar craving that has pretty much ceased just because I wasn't craving that stuff anymore. And also sleep. I was like waking up every hour or 2 hours and not even going to sleep until 1, 2 o'clock in the morning, and then getting up at 5 and totally drained.
And now after 6 months of taking advantage of the bioidentical hormone treatment, how did it change your life?
The sleep factor was number one, and just overall state of mental health too. You know, it changes your brain chemistry and your function and the way your skin looks and the way you feel, enjoying life, feeling good about myself. Another thing too is the feminine aspect. The dryness has subsided. There's hardly any of that, and when there is arousal, it's there.
And there's another resurgence in the intimacy, enjoyment.
Yes. Before, there was nothing there as far as relationship goes. That was dead. And now it took a good maybe 4 months before that was coming back. Your bodily function, you know, you start to feel those things again within yourself, revitalizes you and your senses about all of that, and it makes a big difference.
Would you recommend the bioidentical hormone treatment to any friend or family or anybody who is going through the changes of life?
I recommend it to everyone. I think that the younger you can start taking care of yourself, closer to menopause, you are saving your own life. and you are bringing longevity to your own life and really purpose, because you start to lose all those things too once you go through menopause. You know, that decline and your mental health, it has a lot to do with mental health, you know, and to have all that stuff functioning again is good. But I suggest for the younger women too, to have their hormones checked out, to see where they're deficient and go start now, because you really don't know what's going on with your body until you have those things tested. It's a major function of our body and our lives.
Have you experienced any unwanted side effects from the hormone regimen, Bioidentical Hormone compounded formula that Dr. Lay has prescribed for you?
In the beginning, I had a little tenderness in my breast, but that subsided. And other than that, the breasts are looking better. I don't know if it was just, you know, the breast getting firmer and better again. That's why that sensation was there, but that's all gone.
And you haven't experienced any facial hair or acne or hair loss, hair thinning on the scalp?
I have not. I've noticed that my hair color is actually coming back, less gray hair for some reason, and that's kind of a strange thing, but it does. There's beginning to be a reversal there.
Why did you choose to come see Dr. Nhi Lê in Victoria, Texas versus any family doctor or primary care doctor?
Because I have a relationship with Dr. Lay of trusting and knowing that she knows what she knows. Very professional.
Seeking out the expert physician who studies and practices and has experience treating patients with bioidentical hormone therapy. How did you come across and find out about Dr. Nhi Lê?
I had seen some advertisement that Dr. Lay was going to start this new practice, this type of treatment. And I've always been real interested in a more natural approach to life and not being on a lot of chemicals and pharmaceuticals. So that's why I chose her. When I'd gone to my first appointment, I was very impressed because Dr. Lay is very thorough and meticulous about everything that she does and really studies when the blood work comes back. She knows what everything means and explains everything where you can understand it and you know what's going on with the blood test and everything like that. She reads and you get your own personal prescription.
Have you met or refer a lot of friends and family to Dr. Lay's practice so she could help them with any wellness or hormone issues or sexual issues?
I've referred quite a few people and they're very satisfied and happy with Dr. Lay. Last one that I referred was my sister, and as a matter of fact, she was not feeling well at all, but she had been on hormones. She took a break too, and we both talked about it, and actually Dr. Lay was the one who got her all fixed up with her hormones, and not only that, found out that she was low in iron and stuff like that and got her going again. So she's speeding along.
She's an Energizer bunny now?
Yes, she is. Yes, she is. And she's my older sister. So.
Wow, that's wonderful.
Yeah, she really appreciates you too.
Oh, thank you, thank you. Thank you so much, Rose, for sharing your story, your journey with Fountain of Youth Medical Spa, and specifically Dr. Lay's Discovering the Younger You Wellness Journey. Thank you for sharing. I know for sure that your story will touch and influence and encourage many patients out there who do have similar medical issues and will be willing to seek my medical expertise. Thank you so much.
Thank you for being here and you taking it upon yourself to do this for everyone and change your life in your path of medicine to do something new.
The movement of self-care and wellness, I like to share with you that the movement of patients' awareness of natural bioidentical hormone therapy and its benefits, as well as how the self-care movement, the nutrition, exercise, wellness, regenerative medicine is going to continue to embrace and touch many lives. I hope that whatever medical service that I have offered and continue to offer to my patients, as well as many potential new patients, that it will also change their life, their vitality, their happiness, and they can live longer and healthier and happier.
I've noticed also that you always continue your education.
That's the key. Medicine and science, everything's evolving.
Yes, it is. And you are on top of it.
Well, thank you. And that's actually my passion. I'm so happy for you, Ro.
I'm happy and thankful.
And I'm so glad I can help you.
Quality of life.
Thank you. You nailed it. You nailed it. Yes. Live a quality life.
Yes.